serious. Doctors of Reddit, what is the most stupid thing a patient has said trying to correct you? I asked a patient complaining of dizziness if she had ever been diagnosed with vertigo. The daughter chimed in and said no, she's a Libra. I then laughed hysterically at her awesome joke. She was dead serious. Patient comes in with abdominal pain. I think it's my gallbladder, they say. Looking over their chart, I see their gallbladder was removed 20 years ago, so that is impossible. I mention this, to which they reply, yeah, but it grew back. I took care of a child that got chickenpox. The mother was strongly anti-vax but was yelling at me, how can modern medicine not have a treatment for chickenpox? She couldn't grasp the concept that we do. She just refused it for her child. Me, sir, I need to know why you stopped taking your antiretrovirals for your HIV. Him, well, I met this witch online that. Me, wait, did you just said witch? Him, yeah, she sent me a bunch of herbs every month to cure my HIV, and they worked. Last time I checked I was cured. Me, where and what tests did you do to know you were cured? Him, I made an online test that the witch told me to. There were a lot of random questions but in the end it said that I was free of HIV. Me, ook, we will need to do a blood test to confirm that. Now, can you tell me which herbs were you consuming? Him, I don't know the name, but I have them right here. Points at his backpack. Me, may I take a look? Him, sure. I opened the bag and what I saw was nothing but grinded oregano with something that smelled like chlorine. The patient, sadly, died from a severe sepsis a month later with a highly resistant microorganism, just because a witch in a website told him to stop taking his meds. A mother brought her 14-year-old daughter to the due to hypergastric pain and spotting. We asked the daughter when was her last period. She said 2 months ago. We asked her for her sexual history, thinking this might be an ectopic pregnancy. The mother kept butting in saying that she is still a virgin and she has no boyfriend. We left it at that, until her mother went out to go to the bathroom. The patient admitted that she had sexual intercourse with a classmate of hers. We requested for pregnancy test and HCG titers. It really looks like ectopic pregnancy. We advised the mother that her daughter needs immediate surgical intervention. She refused to believe us, saying that the lab results are unreliable and untrue. She keeps on saying that her daughter is a virgin. She stormed out of there with her daughter that looks really in pain. A lot of these answers were stupid. This is one of the first that made me really sad. That poor girl. I had a patient once with family members who were some of the most frustrating people I've ever dealt with. The patient was morbidly obese and had open sores and wounds in all her skin folds. Cleaning her when she was first admitted was like some sort of disgusting clown car. We found a floral pillowcase shoved under one fold and what we think was a smashed bread crust in a fold near her groin. Anyway, because of her weight she wasn't a candidate for surgery and therefore there was nothing our team could do for her. I think about 5 or 6 different meetings were held with her family to discuss her prognosis. Her daughter told the attending physician he didn't know what he was talking about and that she had been this sick before and pulled through. Her pH was so low it just read as 6.8 inches and her blood pressure was a solid 60/25 despite every vasopressor under the sun running at 3 times the max doses. When the charge nurse pointed out her blood pressure on the monitor, the daughter said PSH. I've seen lower. When she finally died, her family was livid that we didn't save her. We coded her for 20 minutes and they told us we should have continued for at least an hour. I felt terrible that her last days were spent in such torture, all because her family was in such denial about her condition. Had a patient with atrial fibrillation that needed to be on anticoagulation. I chose Pradaxa and patient said, no, that one does not have any antidote. In fact, it's the only new oral anticoagulant that has an approved reversal agent. Patient refused to believe me, like I got some bonus for killing her or something. A memorable lady was utterly convinced that her friend got cancer because she quit smoking, not because she was a smoker. Duh. This lady had a mild goiter, and her reason for not quitting was that if she quit smoking the lumps in my neck would turn to cancer. Could not be convinced otherwise. Then I referred her to Ent for her hoarse voice and she was surprised how fast she was seen. I said, well, you're a smoker, so they were worried you might have throat cancer. Smoking causes throat cancer. I always needed a strong coffee after her. Had a co-worker tell me my dad wouldn't have died from throat cancer if he never quit smoking. They've said a lot more ignorant crap like this and I'm glad I don't have to work with them often. 1-year-old hospitalized with ingestion of unknown drug. No immediate signs or symptoms. Mother says it is H from her brother's stash. Urine comes back positive for M. Mum gets very angry and defensive and tells us it is just H and we should stop accusing her of having M. Like, lady, why you think letting your toddler try H is so much nobler? I work in community mental health and see a lot of people on a wide variety of illicit substances. It always cracks me up at the number of H addicts that are horrified by the idea of using M and M addicts that are offended that we would think that they would use H. Lady comes in with shortness of breath. We check her troponin levels. They are elevated. Mom, you're having a heart attack. No, I'm not. Yes, you are. No, I'm not. Her PCP came into the ER and fired her as his patient. She signed in against medical advice and left. She died the next day of a freaking heart attack. Yep. I introduced myself to her patient as doctor, your anesthetist. Patient said that I could not be a doctor as anesthetists aren't doctors. Not long after, another patient asked me if I had to go to uni to be an anesthetist, and still another asked me if I had to know as much as a pharmacist. Ophthalmologist here. Told patient he needed reading glasses, which he didn't believe. I explained that everyone develops presbyopia eventually. Come on, George Clooney doesn't wear reading glasses. A. Yes he doesn't. B. Not sure why you are comparing yourself with him. Oh no. 25 years ago I had heck of a time as a kid because I have myopia at age 7. Family didn't allow me to wear glasses unless I'm outside cause they believed the eyes would readjust to normal and the myopia would decrease. I ended up perpetually squinting. No, my myopia never went down. I have very high diopter myopia in adulthood now. Patient stated he got a full fellatio at his previous hospital before being transferred to my hospital. Not sure if he was trying to say filleted in regards to debridement of his lower extremity wound. Patient satisfaction scores at that hospital are great. Had a female patient. Her mom asked me to adjust her scrotum. Trying not to burst out laughing, I said your daughter's scrotum. She acted like I was stupid and pointed to the back of her neck. I knew she wouldn't listen as she was so convinced, so I stopped arguing with her, and I also wanted her to go around saying it to other people. Go to make your own entertainment. Med student, but a patient was telling me about how a doctor suggested she may have shingles of the eye, trying to get me to laugh at the other doctor because apparently shingles of the eye is a ridiculous concept. You can totally get shingles in your eye, though. The time I was telling the family that the patient is going to die and her lab results, pH 6.6, lactic acid 25, are not compatible with life, and they said they were pretty sure she would wake up if I put ice in her underpants. Well, yeah, we are not going to do that. She died and they still didn't believe me she was dead. They kept trying to wake her up. People are weird about ice. I had 2 guys who were absolutely convinced that they could lower blood pressure by dumping ice down their shirts. I didn't have a heart attack. I had a myocardial infarction. That's what a heart attack is, chief. Had a patient come into the ED for what was essentially a cold. Kept requesting antibiotics. Kept explaining that they wouldn't help her viral symptoms. But I did then sit down and give her a basic tutorial on the differences between bacteria and viruses, and antibiotics and antivirals. Hopefully it was enough to help her in medical school finals the next week. I'm a doctor, but this was my nonna, not a patient. She was drinking 11 cups of coffee a day, which is too much. We held an intervention while visiting for dinner, and when we told her she was addicted, she responded, no, the coffee is good for me. It helps me with my shaking. She cut down once we explained to her what drug withdrawal was. The fact that you got a little old Italian lady to change her mind and do what you told her to do is amazing. Might be late to this, but a 17-year-old girl who was pregnant and came into the emergency department to get checked as she was punched in the stomach. She wanted to go out for a smoke, so I did the whole pregnancy and smoking spiel. She stopped me and told me I knew nothing as the baby would be harmed if she stopped smoking straight away. I hate when people tell professionals that they know nothing in their field, especially doctors. I mean, they have to go through so much schooling. When I was a medical student, this middle-aged male patient from a rural area got it in his head that I knew absolutely nothing and he was doing me a service talking to me. He was in colorectal clinic for something unrelated and started telling me about the gland on the back of his neck that would drain every so often. When he saw that I was unfamiliar with this particular gland, he gave me this knowing look, laughed and started instructing me, the dumb little medical student, about this gland. Apparently everybody has this gland for the immune system, but that is would drain when he was stressed. No sir, I was being polite, but you have a nasty freaking abscess on the back of your neck. I was hoping that the patient would try to explain this medical wonder to my attending when he came in, but alas, he didn't. Med student here, but I have had two winners. When discussing a precancerous skin lesion on a patient, they opted to use their laser ray instead of classic treatment. It was a cancer laser ray that was bought online. It also apparently had frequencies for arthritis. They insisted that the vibratory frequency can be tuned to destroy cancer cells, just like a trained singer may be able to use her voice to break a crystal glass. The patient did not believe that cancer cells and regular cells would have the same frequency. Another patient insisted that his cancer had been properly treated at home with baking soda. He gave me a website like fkillscancer.com or something. The patient also had with them a surgery report in which it appears their baking soda consumption resulted in buildup of abnormal calcium in the wall of the stomach, which had to be removed. Veterinarian here. The anti-vax movement has been slowly seeping into my profession for years, but in my area it's gotten much worse recently. Almost every day now I have a client inform me on how toxic vaccines are and that I should talk to their dog's breeder because she is very informed. Most of the time I'm able to convince them that this is incorrect. However, some are still quite resistant. Vaccinating for rabies is not just a suggestion, it is the law, and my clinic has a policy that we don't let any of our healthy animals be vaccine free. I've had a few clients walk out over this policy. I feel bad for their animals. These are the same kinds of clients that won't use flea and tick prevention on their obviously flea infested dog but will use lemongrass and peppermint instead. Spoiler, it doesn't work. Mum of baby, I don't vaccinate, it's against my religion. Me, oh, really? Just out of curiosity, what religion is that? Mom, I'm Catholic. Not really a correction per se, but made me laugh a lot. My mom didn't vaccinate me, and she claimed religious exemption every year because my schools required it. Her religion is like, spiritual. I've had a few patients express dissatisfaction that their Botox only lasted 3 months, and they suspected that I was diluting the Botox. Both statements are absolutely true and consistent. I can give you the full strength, but one of us is going to prison and the other into a grave. Guess which one you are. I wonder how many Botox patients don't know what it is. Why are you looking at my hip? I said the pain was in my knee. Woman with this weird abdominal cramping, twitching presentation. I won't say stupid because she probably had some kind of undiagnosed dementia, but definitely the most bizarre. Ask her what she is feeling. Why she's twitching her abdomen. It's like it's trying to get out. Like what's trying to get out, mom? My sperm. Mom, you don't have sperm. Oh, for those of you curious, by the time I saw her last official diagnosis was pseudoseizures. She had a tendency to start twitching parts of her body whenever we would start asking whether she had twitching in those areas. Mom, have you had any twitching in your legs? She looks at leg. Leg starts twitching. Yeah, I have. Woman with breast cancer. She was in the medical field too, so I am unsure why she said the things she did. Perhaps she was still in denial? IDK. Anyhow, so I was the intern when she came in for a chest tube insertion to drain her pleural effusion. It was obviously suspected to be malignant. After the procedure, I went home and the resident on call had to deal with multiple calls from the distraught staff in her ward, for reasons I shall explain below. The next morning I was told by said resident sporting a haggard appearance and bloodshot eyes from a busy shift, that she was my problem now. With that, the poor man left for home. I go in to see her and first get accosted by ward staff, who tell me she legit refused all pain meds right after procedure, which entailed a tube scratching against her parietal pleura. So I go in and am told by this woman who, let me remind you, was employed in the healthcare sector, that the tube has been pushed in far too much and is stabbing her and that I need to undo the stitch and pull it out a few centimeters. No, lady, I'm not authorized to do that. The x-ray was fine. No intervention was necessary. I tell her she needs to take her meds if she wants the pain to get better, and she says, no joke, that pain meds will further spread the cancer and that I should know that, being a student of medicine. And she further said, look, no need to tell anybody, your doctor, use your own judgment and pull the tube out. Sigh. She was adamant. My professor was going to be late that day, and I obviously wasn't going to do anything without his permission. I documented her refusal and went on my way. She left by the afternoon, against medical advice. I feel bad for her, but she won't letting me help, so yeah. Doctor here. One we get commonly is I know my body. Scoped a guy with knee pain. The joint looked perfect. Told him after the surgery, and he told us no, my tendons are all torn. I know my body. Told a lady she was pregnant. No, I'm not. I just had a big lunch. I know my body. My body is just a casual acquaintance. Probably the legions of women that seemingly don't know how long it can take for an IUD to work and want it taken out cause it didn't instantly stop their periods within a month. Also the women that come in with chlamydia but deny having had sex. Like, come on, I'm not your boyfriend. You don't need to lie to me. I'm the opposite of those women. My IUD literally immediately stopped my period and I rushed to the doctor panicked because everything online said it should stop within 6 months and I thought that meant something was wrong. Gynecologist here. Imagine a revved up version of that dreadlocked beanie wearing woman meme. It's not vagina anymore. It's pronounced vazhina now. Vazhina, the warrior princess. Me. Your blood pressure is very high. You need to take the blood pressure medications I prescribed you. Him. I don't need no pills doc. All I need is Jesus. Well, to be fair, without pills, you'll get to see Jesus very soon. Radiographer here and had the ED doctor give me a request for soft tissue neck x-rays and the doctor was much like don't question it, just do it. Anyway after that patient had left the ED doctor came and told me that the gentleman presented to ED at 3 AM because he had hot milk 3 days ago and his tongue has been hurting ever since. The patient basically burnt his tongue but was insisting on a x-ray to ensure nothing is wrong. Paramedic student here. Not the most stupid thing I've encountered but the most common stupid thing. Do you have any pain anywhere else? Nah, all good. Then what do you take this specific medication for? Oh, that's for my back pain. Or, any past medical history? Nah. Ever been to hospital? Nah. Have you had a heart attack before? Yeah, how do you know? Has a massive personal medication bag to do with cardiac meds. While I am a doctor, this happened to my wife, also a doctor. Female PT came in complaining of infertility. Said she and her partner had been trying to conceive for like 5 years and had tried everything. At one point she let the pronoun slip she and I. And my wife said, wait, let's back up a minute. Turns out the woman had been in a hetero relationship for a few years and never got pregnant despite using no protection. She then entered a same-sex relationship and again never got pregnant even though she really wanted to, leading her to believe she was infertile. When my wife tried to explain that conception requires sperm, sourced from a male, as well as an egg, the PT was incredulous, and exclaimed that she didn't need a man in my life and she didn't like being judged. Perhaps needless to say the patient was lost to follow-up. Even worse is that unless this woman was trying to secretly get pregnant, then 2 women were dumb enough to think they could get pregnant without sperm. When I was about 16, I went to the hospital with sharp pain in the lower right hand side of my abdomen. It seemed pretty serious, so both of my parents were with me, which was unusual because they had divorced. A doctor looked at my symptoms and said it looked like appendicitis. I groaned. I don't have an appendix. It was taken out. My parents said, yes, you do. When I was 6 I had surgery to correct testicular torsion. I kept both my testicles. My parents politely told people I had my appendix taken out to explain why I was in the hospital. I accepted this as the actual reason for my surgery. So years later when I learned the location of the appendix I assumed they did some kind of laparoscopic surgery through my scrotum to explain the scar there. I was very surprised to learn that I do, in fact, have an appendix. The pain turned out to be from a sharp piece of chicken bone. I am a family practitioner and I had a family not want to vaccinate their newborn because they heard that vaccines were derived from monkeys' brains and they didn't want their child to develop monkey-like characteristics. A vaccine turned me into a newt. You have been visited by the money cat. Subscribe to Updoot Reddit and get rich in 3.8 days. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day you magnificent people.